to Boomer Health at Home. I'm your host, Bakedesirian, Director of Nursing and Ameristaff Nursing Services. Today, I'm joined by Dr. Natasha Bakedesirian. Hello, Dr. Bakedesirian. How are you today?
I'm good. Thanks so much for having me on.
Thank you for joining us. So, Dr. Bakedesirian, I know that your profession is mostly in infectious disease. Is that correct?
That's right. Yep, I'm an infectious disease physician.
And how did you come about that? Give us a little bit of your background.
So after college, I got a master's in public health in epidemiology, which is the study of disease over populations rather than specific patients. And then I went to medical school, did my internal medicine residency. So that's training to take care of adult patients, and my infectious disease fellowship, which is training specifically to take care of people with infectious disease issues.
Okay, wow, great. And I do know a little bit about your background, and you've been all over the world studying infectious diseases. Is that correct?
That's right. So I, about 7 years ago, I moved to Singapore and I worked in a big health system there, and I learned about the Singapore health system and how they do things well and help them to improve some other things. I learned about all the tropical diseases that they have there. And I also spent some time working for the World Health Organization, which was a really great experience.
Wow, I feel very privileged to be speaking with you right now. That's really cool. I have some other questions for you now. So now you're back in Michigan, which we are so thankful as Michiganders to have you here. So what are you doing now that you're back in Michigan?
So when I moved back to Michigan, it was actually after the pandemic had started. So it was in July of last year. The pandemic was underway, and cases in Michigan were, already impacting people's lives. And so I started working for the state of Michigan with the Michigan Department of Health and Human Services, really working on the COVID response and trying to strengthen our COVID response and keep Michiganders safe.
What was your initial thought when you took this job on, knowing that you were coming to Michigan? We had a really hard time in the beginning as a Michigander and as a nurse. It was a struggle. So what were your initial thoughts?
I was very excited to be moving back home. I was living overseas when the pandemic started, and it is always a little bit disconcerting to be far away from family and friends in the middle of something like this. So personally, I was really happy to be coming home. But I knew that Michigan was facing some challenges. When I worked and lived in Asia, we had a little bit of advance warning about COVID-19. We got cases much earlier. We sort of understood what things were going to look like because living and working in Singapore, they had been through SARS before. So they had been through a similar type of experience with a virus that spread in very much the same way. And so I wondered how the United States and how Michigan was going to do, because this is the first time that we've been dealing with something broad spread and really dealing with a pandemic of this scale, at least in our lifetime. So I wondered how things were going to go. I've been really proud of how people have responded. I think that people have really tried to work together. Communities have come together. People have tried to take care of one another. There are stories in the newspaper all the time about folks driving community members to vaccination sites, wearing a mask to take care of their neighbors. So really good stuff.
We noticed that as well. We are a home care company, and it was really nice to see people step up and care for each other. That was one really positive thing that came out of a negative pandemic. So with the news and what's going on with our governor and with the CDC and our government and wearing masks and being vaccinated and quarantines changing due to being vaccinated, I just have a couple questions for our audience on that. So when you're vaccinated, you should still wear a mask, correct?
Wow. The CDC has come out with some guidance that really supports how good these vaccines are. So we have been saying all along that the vaccines are the best way to get back to normalcy. The vaccines are the best way to come out of this pandemic. And the CDC has changed their guidance recently to to really support that and to say that if you're vaccinated, not only are you at a very low risk of getting COVID and a very, very low risk of getting severe COVID, but you're also unlikely to transmit COVID onto other people. So the CDC guidance does support that if you're fully vaccinated, meaning you've had all of the doses you need to get, whether it's 1 dose or 2 doses, and you're 2 weeks after your final dose, you're protected. So you don't have to wear a mask in any of these spaces unless you're in very specific circumstances. So their guidance about schools hasn't changed, guidance in healthcare settings hasn't changed, for example, guidance on public transportation hasn't changed. But the big caveat is it's really hard to tell who's vaccinated. And so if you're going into a store, you're going into a public space and it's really crowded, it's really hard to know whether the people who've removed their masks are vaccinated or not. And so I think for a lot of folks out there, they may not feel comfortable removing their masks, even if they are fully vaccinated. And I can tell you that for those of us who have young kids who aren't eligible for vaccines, there is a little bit of concern, because if there are people removing their masks now because of this new CDC guidance, who are not fully vaccinated, it does worry us about our kids who aren't eligible to take the vaccine yet.
And is it 12 and older that can receive the vaccine now?
12 and older can take the vaccine.
Okay. And that seems to be going well. We've got some good feedback. A lot of parents have been taking their kids. A lot of actually apprehensive parents that we have, their kids have been saying, I want to get vaccinated. Will you come with me and get vaccinated?
That's terrific. That's really great to hear.
Yeah.
The vaccines are really, really safe and effective. And as I said, I think they're the best chance we have to get out of this pandemic. So anyone who's watching today who has kids 12 and older, I would suggest either making an appointment to get them vaccinated, or if you still have some questions, if you're hesitant, talk to your pediatrician and see if your pediatrician has any specific guidance for you.
Okay, great. With more people getting vaccinated, I know a lot of people are starting to go back to work, to their brick and mortar buildings where they're required to be. Here at our building, we've chosen to screen everyone. We have the tablets with the temperature readings and all of the questions. We make everyone sign that. So with vaccinations, if you can prove that you've been vaccinated, you show your card. Do we still need to screen everyone that comes in if we know they've been vaccinated?
Well, I think that number one, getting everyone vaccinated is huge. That's terrific. That's the goal, is to get as many people vaccinated as possible. But we know that no vaccine is 100% perfect, right? The vaccine really depends on your immune system and how well you respond to that vaccine, how well you produce antibodies, for example. So no vaccine is 100%. And so there's always a very small percentage of people who could still develop infection even after they've been vaccinated. So infection is less likely to be severe. They're less likely to have problems from it. They're less likely to transmit it, but people may develop COVID-19 infections even after vaccination. So the key is, after you've been vaccinated, if anyone is symptomatic, if you have a cough, if you have a fever, if you have loss of smell and taste, any of those types of symptoms, it's really safest to isolate right away and then to get tested, even if you've been vaccinated. So I think that your screening protocols are a great idea. However you choose to do it, whatever is feasible for your company, it's great to ask people, are you feeling well, before you come into a public space.
Okay, that makes sense. And I've heard from a lot of just general people that they're going to continue to wear a mask out in public because they've not gotten the sniffles this year. And if they beat the COVID and the flu and the common cold, then they'll just keep wearing a mask in public. And I feel a lot of people feel that way.
I think a lot of people feel that way. We had barely any influenza this past season. So for those of us who, get the flu during cold and flu season, most of us, it's just a minor inconvenience. You stay home for a couple of days, you take some Tylenol, you're feeling better. But there are lots of people who have really terrible consequences from influenza, people who end up in the hospital, even people who die. So we didn't have that this year, and it was amazing. And it really, if we can keep some of those same mitigation strategies, if we can wash our hands the way we have been for the last year, if we can maintain distancing, especially when we're indoors, and if people want to wear masks, we'll be able to keep some of those infections at bay as well, which I think is a really nice side effect of this pandemic.
Yeah, I remember thinking as a nurse, did anybody have the flu this year? I never heard of anyone. Usually, a couple of people in my family get the flu. It was very, very interesting to me.
Yeah. The other thing is people got vaccinated. So in the fall, we had big flu vaccination educational campaigns because we really wanted to make sure that we weren't having what people were calling a twindemic with influenza and COVID spreading at the same time. And if people had been infected with both at the same time, they really could have had bad outcomes. So there was a lot of education about the flu vaccine as well, and I think that helped.
That's great. That's really good. So, Dr. Bakedesirian, my final question for you is, what do you think the future looks like for us here in Michigan?
I think the future looks a lot closer to normal than the past year has. So I think that activities are going to resume. We'll be able to gather with our loved ones more easily. But I don't know if things are going to look quite like 2019. I think when people talk about the end of the pandemic, there was some assumptions that things would go right back to normal, that everything would look the same way. But I think that there are some behaviors that have changed. And I think that there are some types of interactions that might never be the same again. So shaking a stranger's hand when you meet them, how many of us still shake people's hands when we meet them? How long will it take before people start doing that again? You mentioned people are still wearing masks, and I think people might still wear masks for some period of time. Maybe even forever. I think it really depends on your individual risk. So if you're someone who has some health conditions, if you have diabetes, if you have other health conditions and you're worried about your safety, maybe you'll continue to wear a mask. Maybe people will wash their hands more often. So I think that some of those behaviors have been changed, maybe forever. So I think that things will start to look closer to normal. I'm really hoping that kids will be able to be back in school in the fall and stay in school without the shutdowns and things that we saw last year. I'm hoping that some of those things return to normal, but I don't know that things will ever completely go back to pre-pandemic. And maybe that's not a bad thing.
Yeah, correct. I mean, from the general population, it doesn't seem like it. Also, my other question, because I just read this today, boosters.
Yeah. Yes.
Is that going to be in our future?
Most likely. Okay. Most likely. So we know that the virus likes to mutate. Mm-hmm. The more transmission there is, the more mutations happen. And even though things are fairly under control in most states in the US right now, numbers are coming down, people are getting vaccinated. We know that other parts of the world are really in terrible shape with the pandemic. So what's happening in India right now is really unmitigated transmission, we call it. There's just spread of the virus, and about 10% of the population's been vaccinated. So the potential for more variants to arise with that type of transmission is very real. And as more variants arise, we might need to tweak the vaccines. So I think that's in our future. We also don't know how long immunity will last because the virus simply hasn't been around for long enough. There are a few vaccines out there where, a single series protects people for most of their lifetime, but most vaccines, the immunity starts to wane and people need some sort of booster. And so we will have to see, we'll have to follow the data and find out when it looks like immunity is waning and when we'll need boosters. And we'll be following the science and paying close attention to that.
Wow, that's great. This is really great stuff. Thank you, Dr. Bakedesirian. This has been awesome.
Well, thank you for having me on today. It was really terrific to talk to you.
Yeah, so we always end the show with more of a light question. So my absolute final question for you now is, you've lived all over the world. Mm-hmm. Where's your favorite place? And tell the truth. Don't say Michigan just because.
Okay, if I can't say Michigan, I would have to.
Well, you can, but don't say just because we're in Michigan.
Well, I love Michigan, and Michigan is where my family is, and Michigan is where my home is, and Michigan is where my heart is. But Singapore is pretty terrific as well. But Michigan is home for me.
Okay.
So I'm glad to be here.
I love Michigan as well. I'm, true to Michigan State, though. I have a feeling you have another allegiance, and that's okay too.
I do.
Thank you again, Dr. Bakedesirian. This has been very wonderful information. If anybody has any questions, please don't hesitate to contact us at AmeriStaff Nursing Services at 248-288-3270. Thank you. Stay safe and healthy.
My name is Greg Jamian, and I bring you our series on boomer health so we can explore together important healthcare topics impacting the baby boomer generation today. As a home health professional for over 40 years, I'm happy to share my team's knowledge as baby boomers seek answers to difficult healthcare questions. This show provides valuable resources, ideas and tips, and cutting-edge solutions that will improve your everyday life and health. Don't forget to join us for all the other shows in our Boomer Health at Home series.